The number of hard drug users in Nigeria has risen to over 14 million. This figure is higher than the entire population of some European countries. Now, the report released by the National Drug Use Survey shows that 14.3 million Nigerians captured in the drug use survey are between the ages of 15 and 64, and 1 in every 4 of them is a woman. This first ever large-scale nationwide study by the National Drug Survey was conducted by the United Nations Office on Drugs and Crime, UNODC, in collaboration with the National Bureau of Statistics and the Center for Research and Information on Substance Abuse, with funding from the European Union. With intense clampdown on hard drugs, trafficking and drug use going on in the country over the past years, how did the number of drug users in Nigeria rise to more than twice the global average of 5.6%? How can the country improve on its drug control policies? And what is the best way to rehabilitate the close to 3 million Nigerians already dependent on some form of drugs? Well, we will continue shortly with answers to these questions and more on Nigeria Today. I am Anne Jibuno. Welcome. Now in the studio to discuss drug misuse and abuse in Nigeria is Otumba Lanre Ipimisho. He is the former Director General, National Drug Law Enforcement Agency, NDLEA, and also member Presidential Advisory Committee on Eradication of Drug Abuse. Welcome to Nigeria Today.
Thanks for having me.
And we also have Dr. Alkali Albert Kelong. He's the immediate past national chairman of the Association of Community Pharmacists of Nigeria. Thank you for joining us.
Thank you very much for having me.
Now, I'll start with you, Otumba Lanre Ipimisho. What does this survey mean to you? Is it accurate? Rather alarming there.
Yeah. Thank you. I was at the presentation of the reports, and believe me, we were devastated. Because the meaning is far-reaching. 14 million is huge. I had the privilege of being in Indonesia to seek the release of Nigerian convicts, and they told us that it wasn't going to be possible because they were having about 3 million Indonesians who were on drugs. And considering that, they were going to take whatever measure it will require to ensure that that number is brought down drastically. 3 million in Indonesia, 14.3 million in Nigeria. In the place, the system worked together to fight the scourge. In our case, we're just trying to rejig now with this new Presidential Committee on Eradication of Drugs. They had to sack some high-ranking prison officials there because even those who were in prison were still doing drug business. You can see how holistic. So drug, as overwhelming as it is, we must fight from every angle to successfully. We cannot have this. The whole world, 5.6. Nigeria, 14.3 million. It's not acceptable. It's enough for us to shut down everything until we successfully fight this and win it.
Now, Dr. Albert, you are a pharmacist. Why is this number increasing, despite the fact that there's so much effort to fight this war against drug abuse?
I think basically what the problem we have in this country is the issue of regulation. And if regulation is going to be effective, it has to be holistic. Now, the abuse, apart from the illicit use, even the drugs that are being prescribed are being abused. The problem of drug distribution in this country has led the Pharmacists Council to look at pharmacy laws and ask for a review. Now, these review laws have been passed and they are awaiting presidential assent. I think government must take regulation very seriously and must empower all the regulatory agencies to carry out their regulatory functions in collaboration with other agencies. I expect NDLEA to be collaborating with the Pharmacists Council, with NAFDAC, to holistically tackle the issues of drug abuse.
I mean, you're not working together at
I think there are gaps.
Yeah.
There are gaps. There are no collaborations. I don't see. I have been working in the as a chair. I have been part of pharmaceutical inspection committees, and we've not seen that. And I had calls to actually go and intervene in some cases in the NDLA offices on some infringement here and there, you know. And if you look at the council, our council, for example, the council has not been constituted. How do you carry out disciplinary measures? You know, so the government needs to look at it holistically. Even the Presidential Advisory Committee, I am not aware that there's a pharmacist on that committee.
There are.
There are. Okay. But the organ, the Pharmaceutical Society of Nigeria, I seem to be in in the dark on the activities of the advisory committee. So government must look at this problem holistically, declare an emergency, and call all these regulatory agencies to sit down and give us solutions.
Now let's talk about the survey proper. Now, yeah. Doctor, I'll stay with you. What's the most abused drugs captured in this survey?
Well, I don't have a detail of that survey, but I know the cannabis, that's cannabis, marijuana, and all that, and even the prescription drugs like the cough syrups. We had an epidemic of recent. It was aired live in the country. There are lots of other drugs, even substances that are not medicinal products, yes, are being abused. Okay, that's the.
You wanted to say something, Otumba?
Yes, I wanted to say on collaboration that you spoke about. Very, very important. This PASEDA is consisted of 27 members. Largely organizational. We have the Dean of Faculty of Pharmacy in the University of Ibadan as a subcommittee head, actually, a professor of pharmacy. And aside from that, on Friday last week, we invited and received PSN and PCN in our office. They did some presentations. We have asked them to give us something more elaborate, so that, because we are seeing it from this holistic angle he mentioned. And the first time that the president, the federal government, is bringing all relevant agencies together. We have two levels of this committee. We have the ministerial level, consisting of all the relevant ministries: education, health, finance, budget, planning, justice, all. Interior, so that there is no area left uncovered now. Ministry of Health, you know, the other level, which is advisory, to which I belong, has Women Affairs, Sports Ministry, all embracing. And those who are not even members now, like PCN, we have reached out to them, NMA, all, so that we can all holistically look at it and agree on how best. If you look at the report you were referring to, yes, it's stated there that we do not have a one-way solution to fighting drug abuse. It has to be all round. And this is the strongest weapon. You know, it's a social re-engineering we're doing. This is one of the strongest weapons. That is the statistic. You must have your data at hand, so that you place your priorities properly. Like we're aware now, how many rehabilitation centers do we have in Nigeria?
I was even coming to that.
How many rehabilitation centers do we have in Nigeria to confront this scourge of 14 million? We don't have up to 500 bed spaces for inpatients in the whole country. We don't have up to 200 psychiatrists to attend to them. Because we don't have the institutions, there are no human resource capacity to face it.
Let me ask Doctor. Doctor, do you have an idea how many counseling centers and treatment centers we have across the country? Since,
like he rightly said, we do not have up to 25. I think it's so few. It's so few that I mean, this amount is overwhelming. And even the few that we have, they do not have the personnel required. The personnel requirement is not there. So I think we will need to first of all go to the root cause of this epidemic,
which
is basically on the drug distribution system in this country. Yeah. You see, people do not appreciate the fact that drugs are articles that should be treated with care.
Yeah.
People see it as just an item of merchandise, you know, because most of these people start from the small OTC drugs. Before you know it, they graduate to the big ones, and they graduate and they go. So unless we sanitize that, and in sanitizing that, I would like to use this opportunity to call on the President of the Federal Republic to sign that pharmacy law immediately, so that the Pharmacists Council will be properly, will have that legal framework to be able to really come hard on people that are practicing. There are so many illegal premises that were in this country, so many, and so many illegal manufacturing outlets. I know the NDLA has closed down so many in anyone.
Okay,
you know, making amphetamine and methamphetamine and what have you.
Now, Tumba, the situation wasn't this bad in 2018. What's really the challenge? Are the smugglers getting smarter?
Yeah, all over the world, there has been like 50% increase in production. And the more frightening ones are the normal drugs of prescription that are manufactured to help us in ailments. Now, we have what is called tramadol, which is as bad as codeine now. The highest a patient will probably require is no more than 100 milligram. But in Nigeria, you can find 450 milligram, 500 milligram, that is deliberately packaged as a weapon of attack because they know it's not going to a hospital. It's just for abuse. So when you look at the package, you may not find manufacturer, you may not find, you just see them like that. And over 1 billion has been seized between NDLA and customs for Nigeria alone. So when you have this type of statistics and you can sleep, then you don't understand. Because it means if you want illegal weapons, abundant. Illegal small arms, abundant. Drugs, narcotics, abundant. Idle hands to use them. Idle hands to use them, abundant. Process of corruption, serious money found in terrible minds, abundant.
Okay, I'll have to stop you here. We want to hear from Nigerians on the street. Well, this is Nigeria Today. We're discussing drug misuse and abuse in the country. We'll now take a short break from the studio to link up with our correspondent, Alika Okpanachi Arua. She went out earlier to speak to ask Nigerians what they think of this drug issue. Stay with us.
Not taking the appropriate drugs prescribed by the doctor can be drug misuse. Then another one, taking drugs I don't know about, like taking some of these hard drugs that doesn't know the implications.
How will you take drugs for an illness you don't know? You know, you may be having headache, yes. You don't know what actually triggered that headache, right? So, not visiting a physician to like get proper prescription, going ahead to buy Panadol and something, that might probably cost you more damage than good.
I think the cause of drug abuse in our country now is lack of employment, and I think someone who does not have anything to do, an idle man or an idle youth, would always want to vent his idleness on drugs.
We are facing a kind of societal hardship which the government are trying to tackle, and that's why the government brought a lot of policy to reduce poverty in the society, like trade money, the market money, the farmers' money, and all this. You see, drug abuse is like an attitude.
Most of our youth take Indian hemp, tramadol, Exol, and the rest of them. There are some syrup that our youth used to take, and it has so many effects. Most of our youth, 90 to 98% of our youth, used to take into drugs.
I can say it's peer group, like bad friends. Maybe for instance now, she's my friend now, and I'm smoking and she's not. Because of the way our relationship is, the way we are tight, the way we share things together, I can also teach her.
Drugs, I didn't ever take something like drugs. You understand? Even India, I didn't ever smoke it. But cigarette and beer, I'm taking before. You understand? But now I am born again. I thank God. You understand? Because this is normally cola. You understand why I'm taking? Have you seen me with any exhibit?
We're back in the studio with Otumba Lanre Pimisho and Dr. Alkali Albert Kelong. Now, you've listened to Nigerians, you've listened to their comments. Do you think they understand the gravity of this situation, and how can Nigerians help their friends and relatives who are on drugs? I'll start with you, Otumba.
Yeah. Thank you very much. You see, this committee I'm talking about, by the time we finish the assignment of the committee, Nigerians will have some relief, because there has not been a time in the life of this country that a deliberate effort at this level has been made. Let me tell you what the president said when he inaugurated the committee. He said there is perhaps no other problem that is more devastating on the country than the drug scourge. The same thing the SGF buttressed in his address. So if the political will is there now, you will find everybody falling in place. General Abuba Marwa is handling the PASEDA, the advisory group, and you won't believe how much we have been able, Nigeria is huge, how much we have been able to put some glue in between spaces, between agencies. They are now working together. We have not even, we inaugurated on the 10th of December. By the time we finish, I believe that every stakeholder that needs to do something for us to be on top of the situation we are now will fall in place. For instance, NDLEA, we have listened to them. Ministry of Health, we have listened to them. Information, we have gone to all the ministries that are relevant. Like he said, NAFDAC, all of them. By the time we get all the agencies to work together, we'll be able to deal with it. Now you can see the information on the field now, which means awareness.
It's being created.
Yes,
now I have to move on to Dr. Alkali. Now, you are a pharmacist. From the survey, we noticed that the country has the problem in Nigeria is in the north and in the south. So the north, in the south, we have medically prescribed drugs, and then, sorry, in the north, medically prescribed drugs, and then in the south, cannabis and the rest. So why is this the case, and what's the problem?
Oh, well, all this will have to do with basically the access to these hard drugs, and also has to do with regulation. Like in the north, for example, we have one big problem in Kano, for example, with an open drug market in Sabongari. In the open drug market, you can virtually get everything: tramadol, the restricted Benelux codeine and all that. So because there is no much restriction on access to those prescription medicine, people abuse them a lot in the north. In the south, basically it's, you know, because the tropical area and the heavy rainfall there and all that, the people there are lots of people that farm these drugs in there, especially cannabis, and we have a lot of illegal farms that have been destroyed by NDLA, and people are still insisting on farming them. Those are the reasons.
Now let's talk about the National Drug Control Master Plan. Otumba, what should it contain? It's been formulated right now. Yes.
Incidentally, we were at a workshop where we also contributed to. Now, the National Drug Control Master Plan needed to be taken more seriously now than ever before. Now, I'll give you an item. An item that Nigeria requires about 703 kilograms. About 10 tons are being imported every year. 10 tons against 703. What do you do with the huge difference? So the government is taking the National Drug Control Master Plan very seriously. We're reviewing what went wrong with the past now. The new one is being formulated so that we can place it appropriately where it belongs. In the US, it's in the White House. National Drug Control Master Plan. That's how serious it is. If you need something to make cough syrup for 1,000 people and you bring in for 100,000 people, then something is wrong. So that is where the key is, how to control what you bring in the first place.
Okay, now, Dr. Albert, when we talk about drug abuse, most times we talk about hard drugs. How about drugs like paracetamol and those kind of drugs? What are the implications of abusing these drugs?
The implications are actually far-reaching. That is why we are always advising the public, if you're going to pick any drug at all, if it is an OTC drug, ask your pharmacist on duty. If it is a prescription drug, then you must carry your prescription to the pharmacist to be able to dispense this drug. Then one big problem that we have now on ground in the country, we don't have standard prescription in this country. The prescription policy has been moribund. Nobody, it's not, in fact, it was supposed to have been proposed and then implemented. We don't have one now. So people just write anything on a paper and say it's a prescription. It's not. We don't have identification. In this era of IT, we should be able to identify who is prescribing what and who is dispensing what. We don't have that. So, but generally, right now, people should pick their medication from registered pharmacies, and they should not take other people's remaining drugs. Oh, because I've taken paracetamol and that was prescribed for me, somebody that's now having a headache should take the remaining. That's an abuse.
Okay, now let's talk about this survey. Certainly, it's going to impact the prevention and care services and help reduce deaths and all that. What do you think, what far-reaching impacts do you think the survey will have beyond what we've discussed so far?
I think the survey will help government in, churning out policies that will fully tackle this issue, this epidemic. With the magnitude of the issue, I think, government should now focus. I'm happy that there's already a ministerial committee in place, advisory committee in place to ensure, to come up with information to advise government on the way forward. I think government must take this very seriously. Government must ensure that all the regulatory agencies carry out their duties. They should be able to report, give reports, either quarterly or annually, on what is happening in the pharmaceutical sector or in Nigeria generally, to ensure that we bring down these statistics down. The statistics is going to really help government to churn out policies that will help us, prevent the escalation of the already worrisome situation that we have.
Okay, very, very briefly now, Otumba, how can the country improve on the drug control policies? Very briefly, please.
Well, by getting its organs to be responsible to the objects of their creation, like NDLA, Ministry of Health and other, and they must work together. Parents, so communities, everybody must be on the table to tackle this problem. Otherwise, the blame game will continue.
All right, that's all we have time for. I really must thank you, Otumba Larry Pimisho, former Director General, National Drug Law Enforcement Agency, NDLEA, and also member Presidential Advisory Committee on Eradication of Drug Abuse.
Thanks for having me once again.
And I must also say thank you, Dr. Alkali Albert Kellogg, immediate past chairman of the Association of Community Pharmacists of Nigeria. Appreciate your comments today.
It's a pleasure. Thank you very much.
And before we go, we'd like you to go online on www.youtube.com//NTA News 24 Hub to watch this edition of Nigeria Today and other NTA News 24 programs. We thank you for watching. I am Anne Jibuno. See you next time.